Hello, everyone, and welcome back to the NWR Virtual Healthcare Day for November 2021. My name is Finn Blake, and I'll be your host for today. Up next this morning, we have Respiri. Respiri is an e-health software as a service company supporting respiratory health management. Its world-first technology detects wheeze, a typical symptom of asthma, COPD, and respiratory disease, to provide an objective measure of airway limitation. Wheezo, Respiri's innovative technology, comprises of an e-health app combined with a simple, easy-to-use handheld device. Wheezo is the first smart device to help improve asthma management by monitoring wheeze and documenting symptoms, signs, triggers, weather conditions, and medication use. The asthma management platform also facilitates the sharing of data with caregivers, physicians, and other healthcare professionals. This morning presenting will be Marjan Mikel, the CEO and Managing Director. Just a heads up, if anyone in the audience would like to submit a question for the Q&A session at the end of the presentation, please do type it into the Q&A panel on your screen at any time. Without further ado, I will hand straight over to Marjan.
Yeah, thank you, Finn, and welcome, ladies and gentlemen. Thank you for joining us today. 2021, what a year it's been. And although not everything's gone to plan, we have achieved quite a bit in our aspirations of becoming an internationally based company. So our international expansion plans have gone to plan and in many cases have been ahead of schedule. And as I said, although not everything's gone to plan, there are only certain things we can do with virtual borders being closed and the pandemic throwing a spanner in the works. But more of that in a moment. We exist as Respiri for one reason and one reason only. We are here to improve the lives of patients suffering from respiratory disorders, asthma and COPD. Problem today is the moment a patient leaves the care of their physician, that physician has absolutely no idea what's happening with that patient in the real world, and neither does the patient. Hence, it makes it very difficult to provide a quality of care akin to some of the other major disease states where ambulatory monitoring currently exists, whether that be diabetes or cardiovascular disease. Asthma, remember, is the third largest disease to afflict the human race. So our goal is to make sure that we provide carers, physicians, and patients with a way of better monitoring what's happening with their asthma when they leave the care of the clinic. And our vision really is to see what it is we can do to rid the world of the challenges of asthma. Highlights to date, many of you would have heard this already, but in the past 18 months, this year in March, we achieved our FDA approval for Wheezo, our 510(k) approval. We completed the patient experiential program. Outcomes for those programs are extremely encouraging, although patient engagement required some intervention. As a result, we developed the respiratory physician-led remote asthma monitoring program, or RAMP. There was a dramatic improvement in patient engagement with Wheezo and the app, and I'll get into that a little more in a moment. The patient outcome trends continue to be very, very positive. Importantly, they are early trends and we will need more water to flow under that bridge, but we hope to get data available for us by the end of Q1 2022. Now, this model is particularly useful for us in our endeavors to secure reimbursement and customers in the much larger markets where Respiri's success will be determined, that being the US and also Europe and UK. On the local scene, it also provides us with a new channel for Wheezo sales that will be respiratory physician-led and also a position to actually approach employers for patient wellness programs. Pharmacy sales have not met company expectations, and we're the first to admit that. And as I said, I'm not going to go over old ground, but things have been difficult with shutdowns, lockdowns, and also borders being closed. Plans have been adjusted accordingly to get bigger bang for buck and identify those pharmacies that are more inclined to provide professional services to their customers. So the focus now is depth of penetration, not breadth of penetration. Wheezo 4.0 is developed and the COG targets has been achieved and will be achieved in 2022 when we commence that run of manufacturing. We've still got stock available to us at the moment and another run of the 3.0, which will be outed by the very latest February next year. The app has been upgraded. It's pretty exciting stuff because we believe we're the first app in the world to include the clinically proven asthma control questionnaire, the ACT, which allows us to correlate the wheeze rates, other parameters and other factors that may cause exacerbations and quality control through the asthma plan, and correlate that to the asthma control questionnaire to determine proper outcomes, which again is very useful information. On a side note, we were the winner of the Good Design Gold Award for product design in medical and scientific. And we've commenced the development of our new wearable product, Sorfair, which is Persian for cough. And it's been developed not to replace Wheezo, but to bolster our portfolio and will be used in nocturnal asthma and exercise-induced asthma monitoring, two areas that are grossly misserviced at this particular moment in time. And I'll get into a little more about that later. It's important to note that unlike the Australian marketplace, the international market launch of Wheezo will be physician-led and focus on reimbursed markets. In the US, for instance, we are in discussions with 6 potential telehealth remote patient monitoring chronic care partners. We've already secured 2 non-binding term sheets and are working very closely with those partners to engage with customers and start with the pre-marketing of Wheezo in the US next week. So next week, we'll be talking to our partners' customers with Wheezo and what Wheezo can deliver to their patients. Clinical partnerships have been discussed with a major pediatrics hospital and are being finalised as I speak. In the UK, we've made some significant progress, particularly with Birmingham University, where we're doing a study to look at relationships between wheeze rate and wheeze phenotype with lung function, FEV1 using spirometry. We've also secured a major third-party funded asthma medical device outcome study in children through a university, and that is a significant an event. It'll involve 1,500 patients and will focus on determining the benefits that Wheezo can provide to patients, in addition to the current care and the medications that they're on. Reimbursement opportunities may result as a cause of this particular study. Partner negotiations and discussions are ongoing in the UK. Potential partner identified for the 4 major markets in the European Union, and those discussions are moving ahead quite nicely. It's important to note that we are well ahead of schedule with the US marketplace and Europe. For those of you following the stock, we made the call that the US launch would occur in Q3 next calendar year. We're well ahead of schedule and well ahead of meeting those expectations. Europe was supposedly scheduled for the first quarter of 2023. And again, we believe we're well ahead of that particular timeline. The UK was scheduled for Q4 this year. That'll be delayed by a couple months and it'll occur in Q2. We're finalizing partner agreements and also these 2 significant studies in the US, and those will act as the catalysts for us to start investing in that marketplace. So we're using time and prudent investment to make sure that we don't, invest money unnecessarily. Just to remind us, as I said today, when a patient leaves the care of their physician, there is absolutely nothing available to either of them or the carers to help them understand how well their asthma is being controlled. We provide an integrated ecosystem to support asthma management, provide objective and transparent data to all those people that are involved in the care of that patient's asthma. Nothing like this exists at the moment, and we are first. We have done some significant work in doing 2 things. One is proving that our algorithm and Wheezo work in detecting wheeze. Now, we know from the studies that we've done, and this was a requirement by the FDA, by the way, that our algorithm is at least as good at detecting wheeze as experienced respiratory physicians. And that's the graph on the left-hand side of your screen. So I won't go through the numbers, but those numbers are highly significant. One of the major findings from the patient experiential program, which was conducted last year, was that for the first time, we correlated wheeze rates with increased symptoms. We know that from the work that we've done, that when patients have a wheeze rate of higher than 3%, they have a significantly higher level of other symptoms. This has never been shown before, and that p-value of 0.05 is statistically significant. And augurs well that we know that now there is a correlation between higher wheeze rates and other symptoms as documented in the PEP, or the patient experiential program, and that will continue to be documented in the RAMP, or the remote asthma monitoring program, particularly now with the inclusion of the ACT, the asthma control tests, where we can fine tune this understanding even more. So that's pretty exciting stuff from us, and it's a first. Important to note that I mentioned that we developed the asthma, or the remote asthma management program that is physician-led. The great thing with that program is the increased engagement, or patient engagements that's resulted. The program is more than Wheezo. It's a highly tuned app that helps the patient, that is, also, I guess, understand why they're doing what it is we're doing. And it also involves clinical nurses to help support them on an ongoing basis during their journey towards better management of their asthma. So you can see from the graph that we've seen a threefold improvement in patient engagement, with patients now using Wheezo more than once a day. Now, I won't go through some of the quotes that have been written below, but suffice to say that the level of engagement and customer satisfaction has been particularly high with this program. And as I said, this program forms the basis of programs that we will take to the bigger markets abroad, so the US, Europe, and the UK, where our success will be determined. They are the markets that really matter. And in Australia, it provides us with an additional channel for selling Wheezo outside of pharmacy, and also provides us with a discussion to be had with employers and employee wellness programs. So very exciting stuff. I thought I'd take the opportunity just to ensure that everyone understands the size of the United States opportunity. There's the population of patients with asthma in the US is bigger than the entire population of Australia. That means that 1 in 13 people in the US lives with asthma. 1.6 million emergency department visits are conducted every year because of asthma attacks. That costs per event $8,238. So a huge cost burden per admission into ED. COPD, whilst not quite as prominent, 1 in 20 people in the US have COPD. That's chronic obstructive pulmonary disease. And about half the number of ED visits result as a result of attacks from COPD. It is very important to note that these patients are particularly ill, and the cost per inpatient medical event is almost 3 times what is 3 times what an asthma attack costs. So the takeout there is respiratory disease places a significant burden on the US healthcare system. It's a huge healthcare system, a huge population, and at the moment, things do not appear to be getting any better in these areas. So asthma and respiratory control and management isn't keeping pace with the likes of diabetes and cardiovascular disease. Like all countries around the world, as a result, I mean, you know, the patients and doctors face similar challenges everywhere. I mean, spirometry is almost impossible for some patients. With children and elderly finding it very difficult, even with a clinician in the room. Now, the notion of having those same patients do spirometry in an ambulatory setting is not good. Healthcare literacy amongst patients and carers continues to be poor. And it's our duty to make sure the patients understand what they're doing and why they're doing it. Adherence to medications in asthma, like any other disease state, is poor, and up to 50% of patients will stop using their medications effectively after 6 months. We know that the newly introduced remote patient monitoring and remote therapeutic monitoring CPT codes for reimbursement will make this service more available to patients across the US. And we also know that the low socioeconomic status of people increases the burden of respiratory disease, particularly in men. And we all know that the quality of air and pollutants are known to irritate and impact respiratory disease. So effective management really requires a partnership between the patient, their treating physician, and also their provider, together with the utilization of an innovative medical device that allows all of these people to understand what's happening with the patient when they're in the real world, because that's when there are problems. Very few people have an asthma attack when they're sitting in front of their doctors. There is a huge opportunity, and that opportunity is for ourselves. A reminder that we are an FDA-approved medical device, Class 2. Wheezo is a handheld battery-powered device that records breathing over 30 seconds. And then that breathing is recorded and analyzed for wheeze. Those breath sounds, all of the breathing and wheeze are transmitted to a mobile app via Bluetooth. And the algorithm is contained within the app that then analyzes that breathing. Now, remembering that breathing is also uploaded into the cloud and is available for physicians to listen to. It's not lost. So it's not just our wheeze score, but it's also having the doctor being able to listen to a patient's breathing, like they would with a stethoscope, in a period of time when they may have had problems, and then look at all the other exacerbating factors around that to determine what the problems were. Now, this does not exist today, and this is a very significant step forward. I won't go through that. Now, a reminder, there are reimbursement codes available in the US right now for remote patient monitoring codes, and a doctor can make up to over $1,350 per annum if once they give a Wheezo to a patient. And our revenue source there through our partners is through product as a service, where the doctor will be billed by patient by month for the services that we provide. That include the Wheezo device itself, and then access to the app and the portal behind that. So there is currently an existence of these reimbursement codes in the biggest market in the world, and it dwarfs every other market anywhere else in the world. The discussions that we've built with our partners at the moment have been very, very successful, and the level of interest in what it is we do and the interest in wanting to partner with us has been very, very encouraging. And the reason we do that is because integration models, we have a few that we can support. So we can utilize our standalone portal and a solution, or integrate into our partners' existing platform. So that's something that we're currently doing. And we have partners that straddle that fence, one or the other. Technical integration approach is very important. We seek to understand what our customers and partners, or how they operate, and much more importantly, how their customers operate, and how we can make a seamless integration of Wheezo and the app, the Respiri app and portal, into the way that they operate. Now, the benefits, well, in-house capability to integrating the systems. We have our knowledge of the respiratory area and domain included, and seamless integration into partnering systems. Now, we have recently onboarded a chief technical officer who has been leading this charge with our chief commercial officers. So we're making some great inroads here, and it's paying off. The benefits, I mean, from the healthcare professionals, there is a new source of revenue for them with the CPT codes in a cohort of patients that they don't currently use those CPT codes for. An improved quality of care, I've gone through that in detail over this particular presentation, and a better information that allows for a better evaluation of how people are being managed. And that's very important for them to make the necessary changes to treatment to improve that. with our providers, so that's our remote patient monitoring and remote therapeutic monitoring partners, partnering with a class an FDA approved device and a first in class. We provide seamless integrations into their existing systems. We also have our own systems that they can utilize, and importantly, it opens up a completely new cohort of patients, delivering a completely new revenue stream. For patients, again, it leads to improved health outcomes, improved compliance, reduced admissions to hospital, and a reduced healthcare burden for those that are being treated with Wheezo. Again, I reinforce, active Wheezo pre-marketing to US customers commences next week. So we're really excited about the progress that we're making, and the messages and the technology is resonating with our customers in overseas markets. Overseas markets that will be driven by physicians, are reimbursed, and are at least 20 times the size of Australia. So a huge opportunity. So as we move forward, just want to reiterate that our international launch will focus on a physician-led strategy rather than pharmacy. The US launch is well ahead of schedule. That schedule originally was Q3 next year, and we're certainly going to blow that out of the water. We will have a UK soft launch in Q1 2022. Reimbursement strategy is currently being developed with our partners, so that's pretty exciting stuff as well. Advanced discussions with EU partners and developing reimbursement strategies for 2 markets are also well underway, and we're in the process now of finalising agreements with that. And although there's never a deal until there's a deal, we're doing some good things in Europe at the moment. The wearable, I've always said that I never wanted to be a one-trick pony, and the wearable's not here to replace Wheezo, but to complement Wheezo in what it is we do. It opens up a completely new series of therapeutic opportunities that are currently very poorly serviced, those being nocturnal asthma monitoring and also exercise-induced asthma. In Australia, we've not forgotten that we have an investment in this place. The RAMP, so that's the Remote Asthma Monitoring Program, provides a new channel for us to explore as a revenue source moving into 2022. Pharmacy, as I said, we will have a targeted strategy focused on cost-effective use of resources and focusing on depth of penetration with pharmacies that are more likely to deliver professional services to their customers, as opposed to the broader approach that has been taken in the past. So I share a great level of enthusiasm for the organisation as we hit 2022. The messages and the interest in what it is we're doing in the much larger and strategically important overseas market has been very, very comforting and very, very large. So with that, I'm looking forward to a great 2022 and looking forward to continuing our charge towards the internationalization of our organisation. Thank you all.
Thanks so much, Marjan. If you're right to go, we'll jump straight into some questions.
Sure.
The first one being, how is your product different from RAPs?
RAP?
Yeah.
Oh, okay. One is RAP professes to be a diagnostic tool. We're not a diagnostic tool. We are a monitoring tool. So people who use Wheezo have already either been diagnosed with either asthma or COPD. That's the first big difference. The other thing, of course, is that we rely on a device and they don't. So it is our belief that for us to get the quality of recording that we need to make the measurements that we need, and to get those statistically significant results that I described in this particular presentation, we need a high quality electronic respiratory stethoscope that allows us to capture that information. They have a completely different approach to what they're doing.
Sure. The second one is the India launch was cancelled and the UK launch has been pushed back. Can investors be assured that the USA launch will go ahead as planned? Okay.
The UK launch has been pushed back by a month or two, so I do acknowledge that. In the wake of the UK, Australia, and everybody else in the world being locked down. So I hope that people understand that it hasn't been easy trying to get an international presence in the UK happening as quickly as we would have liked. In saying that, we're still 1 or 2 months behind schedule in the UK with partners. The US, we're currently working on binding agreements with a number of partners. And as I said, next week, Wheezo starts getting promoted to US customers, not our customers, their customers. And that'll be the pre-marketing as we move into the binding agreement phase, which I hope to be able to finalize in the coming month or two. And that is 9 months ahead of schedule, 6 to 9 months ahead of schedule. So I'm really proud of what the team's been able to do in that space. And that's 6 to 9 months ahead of schedule in spite of everything that 2021 is throwing at us.
Mm-hmm. And so can investors expect to see, some significant income, or does Respiri plan to do another capital raise?
Well, the beauty of the situation we find ourselves in at Respiri now is we have options open to us about how we fund things. So that's first and foremost, and cap raise is only one of them, but we have sufficient funds to be able to do what it is we need to do for the foreseeable future. Revenues, the larger markets will commence generating revenues in the coming quarters, and they will be significant as we continue to leverage the partnerships that we're forging with our partners in the US in particular, and in the UK as well, and in Europe, assuming the European deal comes across the line. But certainly the former two will be revenue generating in the coming quarters. Amazing.
Adherium has suggested that Respiri is not eligible for reimbursement for the Wheezo. Is this true?
Well, not according to the 6 partners that are very keen to add Wheezo to their portfolios. We've been speaking to a number of major teaching hospitals, a number of county departments of health that see the benefits of what it is our solution can provide their patients with asthma COPD, and see how they can leverage the current RPM codes to generate revenues for themselves. So I'm not quite certain where Adherium gets their information from, and I'm not particularly interested, to be quite frank. What I am interested in is dealing with our customers who are very interested in providing Wheezo to their patients, or their customers and their patients. And that response has been remarkable, and hence why we're 6 to 9 months ahead of schedule in the US in particular.
Beautiful. Probably got time for one more, Marjan. When can investors expect to see the wearable device?
Well, the good news here is one of the things I said early in the piece when I started with Respiri, geez, it's 2 years ago now, wow. I wanted to make sure that we in-housed mission critical competencies into the organization. One of those was product design and product innovation. Now, just to put the wearable into context, we started scoping out the wearable, and I threw this time bomb over a fence to my team over here in June last year. We currently have a working prototype that we're currently testing internally. We're going to phase 2, the next phase, the wearable, which will be available by the end of this month, and tested and ready for clinical evaluation by the end of next quarter. That's Q1 calendar year 2022. It's really exciting. And we're dealing with people at Melbourne University, professors over there that are particularly interested in this particular space, and that space being exercise-induced asthma, nocturnal asthma. There's not a KOL that I've spoken to and who's had input anywhere in the world into the wearable device that doesn't think it's a great idea.
Brilliant. Marjan Mikel, thank you so much for your time today.
My pleasure. Thank you, everyone. Thanks, Finn.